Imagine a medical treatment that claims to reverse tissue aging, restore sexual function, and even cure stress incontinence.
Right.
And it does all this in under 45 minutes.
Yeah, it's wild.
But here is the kicker, the part that really grabs you. It supposedly does all of this without using a single synthetic drug or hormone.
Which is, it's a huge claim.
Exactly. When you first hear that, it sounds like complete science fiction. Or honestly, it sounds like highly glossy, overly aggressive clinic marketing.
Oh, absolutely.
But today, we are actually looking at the hard science behind the so-called O-shot. And we're doing it to answer one very specific question for you.
Yeah.
Can this procedure actually help with vaginal atrophy?
And, that is a question that requires us to sift through a lot of noise because the claims surrounding this therapy are just massive.
So much noise, yeah.
Right. And the marketing often outpaces the public's understanding of the actual biology behind it.
Yeah, and to cut through that noise, our stack of sources for this deep dive is a really fascinating mix. We are looking at peer-reviewed scoping reviews from major medical journals, specifically MDPI and Frontiers, alongside actual clinical trial data.
Which is the gold standard, really.
Right. But we also have direct promotional materials from aesthetics and women's health clinics. So our mission here is to cut right through that marketing jargon, bypass the catchy branding entirely, and just synthesize the hard clinical evidence.
And to do that effectively, we have to look completely outside the traditional diagnostic and treatment landscape.
Okay, how so?
Well, when we talk about degenerative conditions related to aging or menopause, the standard medical reflex is always replacement.
Like hormones.
Exactly. If estrogen is dropping, you prescribe an estrogen cream or a pill. But this therapy, it forces us to look at regeneration instead.
Okay, regeneration. Let's get into that biological mechanism. Because if we're going to figure out if you can treat vaginal atrophy, we really have to strip away the trademarked O-shot name.
Right, the branding.
Yeah, like what is physically happening in the body here? I saw the clinic materials mentioning a centrifuge and, blood draws, but how do we get from a normal vial of blood to a regenerative therapy?
So fundamentally, what the clinics are selling is the application of platelet-rich plasma, or PRP, specifically in gynecology.
RP, okay.
Yeah. It's an autologous therapy, meaning it is derived entirely from your own body.
Got it.
You go in, and the provider draws a small amount of your blood. Usually it's just about 10 milliliters, which is very similar to a standard lab test.
Barely anything, really.
Right. And then they place that vial into a dual-spin centrifuge. This machine uses centrifugal force, spinning the blood so rapidly that it separates the components based on their physical density.
Oh, okay, so the heavy stuff sinks.
Exactly. The heavy red blood cells sink straight to the bottom, and what is left sitting at the top is the plasma, which contains this highly, highly concentrated number of platelets.
And the clinics love calling that separated yellowish fluid liquid gold.
They really do.
But why do we actually care about the platelets? Because we usually think of them just as the things that make a scab when you scrape your knee, right?
Well, they do form scabs, yeah, but their role is vastly more complex than that. Platelets are essentially the body's first responders to tissue damage.
Okay.
When they are concentrated like this and then re-injected into specific areas, in this case the clitoris, the anterior vaginal wall, and the labia, they become activated.
And what does activated actually mean here?
It means they literally rupture, and when they rupture, they release a massive payload of bioactive molecules. In the literature, you will see a literal alphabet soup of growth factors.
Right, the acronyms.
Yeah, like PDGF, VEGF, FGF, IGF, and TGF-beta.
Whoa, okay, wait. Let's stop at the alphabet soup.
Yeah.
We cannot just leave all those acronyms hanging, because you listening right now probably want to know exactly how this works on a cellular level.
Fair enough.
What do those specific letters actually do once they hit the tissue?
So they act as specialized biological messengers that trigger a natural healing cascade. Let's look at VEGF, for example, which stands for vascular endothelial growth factor. Its primary job is angiogenesis.
Angiogenesis, which is?
It's the formation of brand new blood vessels.
Oh, wow. So it's like the city planners suddenly realizing a neighborhood has been completely cut off from the main highway, so they just rapidly pave a dozen new side streets to rush supply trucks back into the area.
That is a brilliant way to visualize it.
Yeah.
Yes, you are forcing infrastructure development in a dormant area.
Right.
Then you have FGF, which is fibroblast growth factor, and IGF, insulin-like growth factor. These specifically signal the body to create new cellular matrix by stimulating fibroblasts.
Fibroblasts. Okay, remind me what those are.
Fibroblasts are basically the microscopic construction workers in your connective tissue.
I love that.
Yeah.
Yeah.
So when FGF and IGF show up, these workers start frantically laying down new collagen and elastin fibers. And that physically thickens and strengthens the tissue structure.
See, this is the part that gave me an absolute aha moment when reading the sources. Yeah, because we are essentially tricking the body.
Yeah.
By injecting this massive concentration of platelets, we're mimicking the exact chemical signals of a trauma.
Exactly.
Like the body thinks, oh no, there has been a massive injury in the vaginal tissue, so it just rushes all these healing resources, new blood vessels, and collagen builders to an area it normally ignores during menopause.
Right. You are centralizing your body's regenerative power into one highly targeted area, forcing it to repair tissue that would otherwise just continue to degrade over time.
Okay, so if we are tricking the tissue into a state of hyperrepair, how does that apply to the primary condition we are focusing on today, which is vaginal atrophy?
Right.
Because if we want to know if it works, we really have to understand the specific structural damage we're trying to fix.
Well, vaginal atrophy, which the broader medical literature now usually refers to as genitourinary syndrome of menopause, or GSM, is a direct result of the natural drop in estrogen.
Okay.
Estrogen is the hormone that maintains the thickness, the elasticity, and the natural lubrication of the vaginal mucosa.
So
When that hormone diminishes, the infrastructure just collapses. The vaginal walls thin out dramatically, they lose all their elasticity, they become incredibly dry, and the tissue gets chronically inflamed.
And reading through the Frontiers Review, the clinical outcome of that infrastructure collapse is severe.
It really is.
It leads to persistent burning, itching, and dyspareunia, which is the medical term for painful intercourse. I mean, it sounds like it profoundly impacts a woman's daily quality of life far beyond just sexual intimacy.
Oh, absolutely. It alters how women navigate their day-to-day comfort entirely.
Right.
Now, traditionally, the gold standard treatment for this is localized estrogen therapy. You apply a topical hormone to repeat exactly what the ovaries stopped producing.
Makes sense.
But with PRP, we bypass that hormonal root cause entirely.
Okay, wait, how?
Instead of replacing the missing estrogen, those injected growth factors, the VEGF and the FGF we talked about, they directly stimulate the local tissue to regenerate on its own.
Oh, I see.
Yeah, they force the vaginal wall to thicken and boost natural lubrication by creating a richer local blood supply. And it does this entirely independent of the body's systemic hormone levels.
Okay, I'm struggling with that a bit, actually.
Okay, what part?
If the ovaries aren't making estrogen anymore, won't this newly built tissue just immediately die off again?
Yeah.
Like, how can it possibly sustain itself without the very hormone it relied on for literally decades?
That is a great question. It's because it is a localized structural fix rather than a systemic chemical one.
Okay.
The fibroblasts build a new, thick collagen matrix, and the new blood vessels provide continuous nutrients to that specific localized area.
Right.
While the tissue will eventually succumb to the natural aging process over time, which is, why the treatment isn't permanent. The physical remodeling of the tissue is robust enough to sustain itself for an extended period, entirely regardless of the circulating estrogen levels.
Oh, wow. And that distinction is absolutely vital for a specific demographic that was heavily highlighted across the MDPI scoping review and the Frontiers data.
Yes.
We really need to talk about breast cancer survivors.
Yes, this is perhaps the most profound application of this entire therapy.
Yeah.
Many breast cancer survivors have hormone receptor-positive cancers, which means their specific type of cancer physically grows in response to estrogen.
Right, it feeds on it.
Exactly. Consequently, their oncologists strictly prohibit them from taking systemic hormone replacement therapy, and they frequently advise against even low-dose topical vaginal estrogen.
So basically, the traditional gold standard treatments for vaginal atrophy are completely off the table for them.
Completely.
They survive cancer, only to be left to suffer with severe pelvic pain and tissue degradation, with very, very few options.
And for these women, PRP serves as an essential non-hormonal drug-free alternative.
No.
It relies entirely on their own biology, carrying absolutely zero risk of feeding a hormone-sensitive cancer.
That's amazing.
It gives them a way to heal their tissue and reclaim their comfort without compromising their oncology protocols at all.
Honestly, just the fact that there is a viable, science-backed option for that specific group of women is a massive takeaway for this deep dive.
It's life-changing for many.
But the sources don't actually stop at atrophy. Because PRP fundamentally regenerates the physical tissue, its effects naturally spill over into treating other issues.
Yes, exactly.
So if we are thickening the vaginal wall and growing new blood vessels, does that physical change directly affect the local nerve endings? Because the clinic materials heavily market this for sexual dysfunction.
It definitely affects the nerves, and this is what we call the ripple effect.
The ripple effect.
Right. When you improve the foundational health of the pelvic and vaginal tissue, you inherently improve the functions that rely on that tissue. The clinical studies explicitly examine female sexual dysfunction, or FSD.
Which is very common, right?
Very. Women frequently report struggling with low libido, difficulty with arousal, and an inability to achieve orgasm as they age.
And the mechanism treating this is neurogenesis, right?
Yes. The growth factors stimulate neurogenesis, which is the sprouting and repairing of nerve endings.
Yeah.
Combined with that massive influx of blood flow to the clitoris and the anterior vaginal wall, the physical sensitivity of the area is dramatically heightened.
Wow.
Arousal is biologically tied to vasocongestion, or blood rushing to the area. By improving the vascular network, PRP physically facilitates that biological arousal response.
But the ripple effect goes beyond intimacy, though.
It does.
The MDPI review looked at studies involving stress urinary incontinence, or SUI. For you listening, this is the very common issue where women leak urine when they cough, laugh, or sneeze, usually due to weakened pelvic floor structures after childbirth or menopause.
Right.
Now, I see how collagen helps the vaginal wall, but how on earth does injecting plasma stop urine leakage?
To understand that, we have to look at the anatomy.
Okay, paint me a picture.
The urethra, which is the tube that carries urine out of the body, sits on a supportive hammock of tissue called the periurethral sling.
A hammock, okay.
Yeah. When collagen production drops due to age or estrogen loss, the fibers of that hammock stretch out and they begin to sag.
So the hammock basically loses its tension.
Exactly. Without a taut hammock underneath it, the urethra lacks a firm backboard. So when you cough or sneeze, the sudden abdominal pressure pushes down on the urethra.
And if the hammock is sagging?
The urethra just gets pushed down into the empty space and fails to pinch shut, causing a leak.
Oh, I see.
But when providers inject PRP into that specific sling, the fibroblasts rebuild the collagen fibers. It literally pulls the hammock taut again, providing the physical resistance the urethra needs to seal shut under pressure.
Okay, that mechanical explanation actually makes perfect sense. And the sources also dive into a condition called lichen sclerosus.
Yes, this is a chronic, intensely itchy and inflammatory autoimmune skin condition that primarily affects the vulva.
Right.
Clinical reviews highlight that PRP has shown remarkable success in improving the quality of life for these patients. The plasma itself contains powerful anti-inflammatory properties that help calm the autoimmune response. Okay. While the growth factors repair the painful microtears and scarring that are associated with the disease.
Okay, let me stop you there.
Yeah.
Because the skeptic in me is flashing a huge red light right now.
Oh, okay.
We just said this one single 45-minute procedure cures menopausal atrophy, treats urinary incontinence, boosts libido, and resolves an autoimmune skin condition.
I know how it sounds.
Right. At a certain point, it sounds like a 19th century snake oil pitch.
Yeah.
Are the sources actually claiming this is some kind of magic bullet panacea?
It is entirely fair to be skeptical of anything that claims to treat 5 different diseases at once.
Yeah.
But there are no magic bullets in medicine. What the literature reveals is that the pelvic floor, the vaginal mucosa, the clitorovascular network, and the urethral support system are all deeply interconnected.
Okay.
They do not exist in isolation. They all rely on the exact same fundamental building blocks: a healthy collagen matrix, robust blood flow, and responsive nerve endings.
So when estrogen drops or a trauma occurs, all of those shared building blocks basically degrade simultaneously.
Yes. And that shared degradation causes a cascade of different symptoms. The PRP is not magically curing a dozen completely different diseases.
It's just treating the root.
Exactly. It is simply repairing those shared foundational building blocks. And when you repair the foundation, you naturally alleviate the various symptoms that stem from its collapse.
That makes a lot of sense.
It is a single mechanism of action addressing a single underlying structural failure that just happens to present in multiple ways.
Okay, I'm with you. The biological theory is sound, and the mechanism makes sense. But we need to do a harsh reality check now.
Let's do it.
We have to look at what the actual patient experience is, what it costs out of pocket, and most importantly, what the hard clinical data actually concludes about long-term success.
Right, because a solid biological theory doesn't always translate to a flawless medical procedure in practice.
Exactly. Let's start with the logistics.
The clinical reality is always a bit more complex than the marketing brochures. The procedure itself, however, is generally well tolerated and pretty much aligns with the clinic claims.
Yeah, according to the clinic materials we reviewed, like those from Optimal Medical Group and Dr. SNA Clinic, the entire appointment is remarkably brief.
Very brief.
They quote about 45 minutes door to door.
Right.
You arrive, they draw the blood, and while it spins in the centrifuge, they apply a highly concentrated topical numbing cream.
Right.
They wait about 20 minutes for it to fully set in, and the actual injections only take a few minutes.
And patients generally describe the pain level as maybe a 2 out of 10.
Really low.
Yeah, they report feeling brief pressure or a slight pinch, but rarely sharp pain. And a major selling point is the total lack of downtime.
Right.
Patients can literally leave the clinic and resume all normal activities, including physical intimacy, the exact same day.
That lack of surgical downtime is honestly huge. But, biological regeneration isn't an overnight process.
No, it takes time.
You don't walk out of the clinic with brand new thickened tissue an hour later. The sources note that results typically take 2 to 6 weeks to really become noticeable as the collagen and blood vessels develop.
Yes, the body has to do the work.
And as for longevity, it generally provides 12 to 18 months of relief, with some patients stretching it to 2 years. But we had to talk about the cost.
The big catch.
Yeah. We saw clinic prices consistently cited around £1,150 for a single session.
And that financial component brings us to the most critical clinical caveat of this entire deep dive.
Yeah.
If a patient is paying £1,150 entirely out of pocket, the medical evidence backing that investment needs to be absolutely ironclad.
Right. Wait, at that price point, I need way more than just promising theory. Does the MDPI review offer actual gold standard clinical proof that this works long term? Or are we still largely just guessing?
Well, the MDPI researchers screened over 3,600 records and ultimately included 43 highly relevant studies in their final review.
That's a solid pool.
It is. And the findings show measurable objective improvements. In studies focusing on sexual dysfunction, patients showed statistically significant improvements in their female sexual function index, or FSFI scores.
Which is what exactly?
It's the standard clinical questionnaire used to measure arousal, lubrication, and overall satisfaction.
Okay, good.
For vaginal atrophy, they took biopsies and did visual inspections that showed measurable increases in the thickness of the vaginal mucosa.
Wow, actual biopsies.
Yeah, and a restoration of normal tissue color, which indicates restored blood flow.
That sounds like definitive proof to me.
It is very strong. The safety profile is also excellent because it uses the patient's own blood. Adverse effects are mostly minor and transient, like temporary injection site bruising or a bit of swelling.
Sure, that's expected with any injection.
Right. However, the researchers highlighted a major systemic issue with the current state of the science, which is considerable heterogeneity.
Heterogeneity, meaning the clinical trials are not uniform.
Far from it. Because there is no universally standardized protocol for preparing the PRP, the studies are incredibly difficult to actually compare against each other.
How different could they be?
Very. Clinic A might use a centrifuge that spins at 1,500 RPMs for 5 minutes, while Clinic B spins at 3,000 RPMs for 10 minutes.
Oh, wow.
They inject totally different volumes of plasma, and they use varying baseline concentrations of platelets.
So basically, as a consumer paying out of pocket, you don't actually know if the liquid gold you are getting at your local clinic has the exact same biological potency as the plasma used to achieve those great results in the clinical trials.
That is the exact crux of the issue. The scientific consensus is clear. While the preliminary data is incredibly strong and patient satisfaction is generally very high, large-scale, double-blind, randomized controlled trials, or RCTs, are still desperately needed.
To standardize it all.
Exactly. We need these definitively established protocols so every single provider is extracting the exact same concentration of growth factors.
And we also definitely need to mention the regulatory side.
Yes, very important.
While PRP technology itself is a thoroughly established, FDA-approved method for processing blood in orthopedics and dentistry, the O-shot procedure, specifically, is not FDA-approved for treating sexual dysfunction or vaginal atrophy.
Right.
It is legally considered an off-label use of an approved medical device.
Which means it requires a candid, highly informed conversation between the patient and a skilled medical provider to really manage expectations and understand the evolving nature of the evidence.
Absolutely. So
Okay.
let's pull all of these threads together and recap the journey we've just been on.
Sounds good.
We set out to find if the O-shot or vaginal PRP can actually help with the structural degradation of vaginal atrophy. And the answer, drawn directly from the MDPI and Frontiers reviews, is yes.
A resounding yes.
It shows incredible biological and clinical promise. By drawing your blood, concentrating your natural growth factors, and injecting them into targeted tissue, it basically tricks your body into launching a localized healing cascade.
Right.
It literally signals the fibroblasts to lay down new collagen to thicken the tissue, and it forces angiogenesis to sprout new blood vessels for restored moisture.
It's fascinating.
And for women who are barred from using hormone replacement therapy, it offers a vital lifeline to restore their intimate health without synthetic drugs.
Yet we must simultaneously acknowledge that medical science is an iterative, ongoing process.
Always.
The evidence strongly supports efficacy, but we are still waiting on the massive standardized trials necessary to establish those uniform protocols and really map out long-term success rates across diverse populations.
But even with those clinical caveats, the fundamental mechanism is just pretty mind-blowing.
It forces a massive perspective shift in medicine, and if we connect this localized treatment to the broader trajectory of medical science, it leaves us with a rather profound concept to ponder.
Oh, I like where this is going.
If we can successfully harness our own biology to regenerate aging tissue, repair ligaments, and calm autoimmune responses, completely bypassing the need for synthetic hormones or daily pharmaceuticals, what does this actually mean for the future of healthcare?
I mean, are we rapidly approaching an era where the ultimate pharmacy isn't a plastic pill bottle on your bathroom counter, but rather the dormant, regenerative potential flowing continuously through your own veins?
The implications for how we treat aging as a whole are just staggering.
That is an amazing thought to end on, because maybe the fix isn't about figuring out how to artificially replace the missing pieces as our bodies age. Maybe it's simply about giving the body the exact tools and the exact location it needs to rebuild itself from the inside out.
Beautifully said.
To you, the listener, thank you for bringing such an empowering, cutting-edge, and honestly highly requested topic to the table. We love digging into the hard science behind the glossy marketing with you. Keep questioning, keep learning, and we'll see you on the next deep dive into the source material.